Okay, here we go with some of the shoulder muscles. As you can see, deltoid, trapezius, and latissimus dorsi are not on this particular model, so I will add those when I have to actually pull up a different cadaver for those. So if you're on your muscle worksheet, which if you're not, please make sure you go to your muscle worksheet right now. We're actually going to be starting with Teres Major. I'm going to be trying to go in the order of the muscle worksheet so you guys can follow along. Do your mental gymnastics, origin, insertion, innervation, action, etc. So here we go. We're going to start with Teres Major, and you can see it highlighted right here. It's coming from that lower inferior angle, lower lateral border of the scapula, which I know is a little bit cut off here, but you can see it's a very wide muscle. It's coming through, and I'm actually going to isolate it. So when you isolate it, you can see how it comes through and actually goes through the axilla. So it's going to go through the armpit, and it's going to insert into the crest of the lesser tubercle. All right, so it stays relatively medial, and it's going to insert. You got to imagine the lesser tubercle is up here, right? And so there's a little ridge that's below it. So that's the crest of the lesser tubercle. You're also going to notice that there's going to be, as we get to it, there's going to be an intertubercle crest, which is a little bit below. And then I'm going to come right, that's the greater tubercle way out here. And guess what? There's going to be a crest of the greater tubercle also. So we're going to have 3 insertion lines below the lesser and greater tubercle. So keep that in mind as we go through the rest of these muscles. So I like to compartmentalize things. So this is a triplet right here. And the first one is Teres Major going to the crest of the lesser tubercle. And I'm going to, bring it back. There we go. So I will again rotate her so we can get back to the posterior side. And there it is. But Teres Major passes through the axilla. So even though it's a posterior muscle, it passes through the axilla, and you can appreciate how it's shadowed out. The next one is going to be Subscapularis, and that's going to be more difficult to find. So we're going to see if we can get it in there. But you can see there's Subscapularis. Okay, so this is actually, if I look this way, this whole muscle is Subscapularis. So there's our Subscapularis. Oops, sorry. The earpiece fell out. There's Subscapularis right here. It's actually on the anterior surface of your scapula. So this is the muscle that is between the scapular bone and the thorax, or the posterior rib cage, okay? So this muscle, much like Teres Major, as you can see here, wonderful illustration here, you can see it's passing right underneath the axilla also, and this one is going to the lesser tubercle. So we're going to have an insertion spot right here on the lesser tubercle. We just talked about Teres Major on the crest of the lesser tubercle, but there is Subscapularis inserting into the actual lesser tubercle itself. All right, so there is Subscapularis. Hard to palpate unless you have them chicken wing, and then you can almost get underneath that medial border of the scapula, and you can sort of palpate a little bit. I just realized I went out of order. I thought it said Subscapularis. I should have done Supraspinatus. So now I'll go back. Sorry about that. Didn't mean to confuse you. We're going to go back to Supraspinatus. And now this is a superior view. So let's orient ourselves, okay? So we have the acromion, we have the clavicle. So obviously this is anterior, this is posterior. So we orient ourselves. And now we're going to have, there is Supraspinatus. As it comes through, it goes underneath the arch, and it continues this way. So I'm going to clear everything, so I'm going to rotate. And there's Supraspinatus. You can see it's coming all the way through, and it's going to end up inserting into that most lateral aspect of the greater tubercle or greater trochanter of the humerus. And again, let's talk about our triplets. We're going to have 1, 2, 3 insertions on the greater tubercle of the humerus. So we have 3 inserting into crests, and now we have 3 muscles inserting into the greater tubercle of the humerus. And our first one, sort of the middle one, is going to be supraspinatus, as it's coming through off the top of your shoulder. It sits obviously in the supraspinatus fossa. Okay, now we're going to move back and I'm going to spin us. Actually, I'm going to reorient. There we go. I'm going to reorient it. So now we're back to the posterior view again. And we have infraspinatus coming from the infraspinatus fossa. You can see there are two muscles below it, and this is going to be important for our orientation. So there's teres major. Here's teres minor, which we haven't gone to, and now obviously here is infraspinatus. So infraspinatus starts posterior. It's going to wrap around, and look at that. It inserts into the greater tubercle of the humerus, and if I angle it, now we have two of our three insertions. So there's supraspinatus, and there's infraspinatus. So greater tubercle, if you're not comfortable palpating or finding it, you better be, because it's going to be one of those structures which we deal with a lot. So that is infraspinatus. I'm trying to spin, and it's not spinning for me, so I'm just going to reset it. Sorry if this is disorienting. So that's infraspinatus, and now here's teres minor. Now teres minor, right there, it's a little muscle, especially compared to teres major, which is just below it. So you can see teres major, much bigger. It's the major, it's the big one. And now we have teres minor, a little bit smaller, coming from the lateral border of the scapula, a little higher up than teres major, and if you can appreciate that difference. And we're going to kind of rotate it a little bit, because guess where this is inserting? And there it is. There's our third insertion right there onto the greater tubercle, greater tubercle, greater tubercle. So we have all of our muscles inserting, the three muscles inserting into the greater tubercle. You are going to notice, depending on which textbook you read, that teres minor does have what they call the groove of the humerus. So you can see, I'm going to use a different color here. I'm going to use red. You can see it's not just one spot. It actually is it's a much longer, so that's actually the groove. So a portion of it touches up here on the lesser tubercle, and then there's the groove of the humerus where the teres minor also inserts into. So we have our three muscles on the greater tubercle, and that would be supraspinatus, infraspinatus, and teres minor. So keep that in mind. We did subscapularis already, so I'm just going down the muscle worksheet. Our next one is rhomboids, which obviously we don't have here because they would be over there on the other side of scapula. So we're going to put those on the other video. Same with levator scapula, Serratus Anterior. Again, they're not on this video. And actually, as I come through, just going to rotate it a little bit. There we go. One muscle we do have, you can see it's cut away, and that is going to be pectoralis minor. Okay, pectoralis minor. Please do not call it pec minor. That is so lazy. It is pectoralis minor. The angle of the fibers, which hopefully you can appreciate, are coming in this diagonal, coming off the ribs. But for our purposes, and if you know anything about the way I've been teaching the class, I like finding landmarks that have multiple structures. This is a big one. Coracoid process of the scapulae. And you can see pectoralis minor, it definitely has an attachment point right there. So while we're on pectoralis minor and we're on the coracoid process of the scapulae, we need to talk about another muscle right next to it, and that is going to be the biceps brachii. Biceps, obviously two heads. You can see one of the heads is coming and inserting right back into that coracoid process. We have one head right there. That's the short head. Then you have the long head, which is coming up this direction. It's passing underneath that transverse humeral ligament, coming under, oops, I'm going to go back to yellow, passing through and actually inserting up here into the superior rim of the glenoid. All right, so technically the biceps brachii attaches to the scapulae in two places. It attaches both the coracoid process and at the glenoid, which the glenoid is obviously part of the scapula. That is biceps brachii and coracoid and pectoralis minor. Coracobrachialis, I know I'm going a little bit out of order, but I figure while we're here, we might as well talk about Coracobrachialis. Again, I like my triplets, so I have Pectoralis Minor, short-headed Biceps Brachii, and Coracobrachialis. If you said it, you found it. The term brachial refers to upper arm, so anytime you see brachial, you should be thinking upper arm, which makes sense. Brachial artery, biceps brachii, triceps brachii, they're all involved with the upper arm. So coracobrachialis goes from the coracoid process to the upper arm. It assists in shoulder flexion, etc. But again, I have been saying this, I like grouping things. So now we have 3 muscle attachments to the coracoid process. The muscle that's not pictured here, and I'm going to clear off all my drawings, of Pectoralis Major. That's it. Is that it? No, that's Subscapularis. No, I'm sorry. Pectoralis Major would actually be coming straight across like this and going across to the crest. Sorry, the crest of the greater tubercle. So it actually be passing over everything and inserting down here. But we'll get that with another muscle. Actually, while we're here, we might as well talk about him, okay? So I mentioned earlier, and I know I'm bouncing a little bit, but we have a crest here. We have a crest. Oh, sorry, I'm going to undo that. Undo. So we have a crest here. We have a crest here. And we have a crest here. I mentioned we have the 3 crests right there. So we already talked about the crest of the lesser tubercle is going to be teres major. The intertubercle crest, or intertubercle groove, is going to be latissimus. You know what? I'll change the color of that. Let's just be consistent. It's going to be Latissimus Dorsi, and going all the way across, spanning basically the entire length of it, going to the crest of the greater tubercle is going to be, get the color right, Aaron, it's going to be Pectoralis Major. Ooh, that's a horrible A. So those are our 3 muscles that are inserting into the crests down below. Okay? So we're going to clear all that. And I'm just looking at our sheet. I guess the only muscle left is, well, there's subclavius. So it's a little muscle that goes underneath the clavicle, and we can move on from there. So then just really the last muscle that's on your muscle worksheet that we haven't discussed is going to be the Triceps Brachii. Obviously, large muscle, has 3 heads, long, middle, and long, medial, and middle head. Only one of those actually touch the scapula at the infraglenoid tubercle, the other coming from the humerus. They extend the entire length of the upper arm, hence the brachii term, and going to insert distally at the olecranon process. Sorry, I just had to take a quick drink. So that should be most of the shoulder musculature. And we'll hit up the other ones in another video. So actually, you know what? I'm just going to pause this video. I'll pull up another cadaver, and we'll do the rest of the muscles. So hold on. All right, we have a new cadaver up here. As you can see, more muscles are here. Now, I am challenging you, now that we have all these muscles here, to orient yourself and start getting in a habit of doing mental gymnastics. And this includes muscles that we have covered from previous sections. So you should already be saying, hey, there's glute maximus. What's its innervation? Where does it originate from? Where does it insert? There should be vastus lateralis, biceps femoris, semitendinosus, semimembranosus. So get in the habit of always reinforcing and always reviewing everything. As a matter of fact, if you want to pause the video right here, take out your trail guide and take out your muscle worksheets for the lower extremity and start reviewing the muscles that you see and tracing them on your screen, I would be doing that right now. It never hurts to be reviewing content. So that being said, let's go back to the top of the muscle worksheet for the shoulder, and let's look at deltoid. You're going to notice the deltoid, I actually think, is one of the most unique muscles. So if you look at a top view, you can see that it actually hits 3 of our main bony structures, right? So you have a little bit of a clavicle right there, so a little bit of clavicular involvement. You got the acromion part right here, so there's our acromion being attached, and then you have, if I go yellow here, you have spine of the scapula, and that forms that sort of horseshoe pattern for the deltoid. And then it's obviously going to come across and come down and have the insertion into the deltoid tuberosity. And if you actually look at the deltoid and you look at the shape like that, it looks like a triangle. And if anyone knows Greek, everyone knows that that is the symbol of delta. Delta, deltoid. There you go. So thank you, Greeks. Thank you for helping us with our musculature. I'm going to go back to this position here. And our next one is going to be trapezius. So I'm actually going to flip it. I'm going to make him a little bit bigger. Slide him down, make it a little bigger instead. And there we have our trapezius. Very large muscle, right? And we're going to highlight, it's a paired muscle, so this is obviously patient left, obviously patient right. So we're going to stay on patient left. Has an origin that comes way up here. So you can see it does come up here to the occiput. And then it's going to go and hit up the spinous processes of the cervical, right? And then it's going to actually come out as we see the fin or the, as it widens right here. Okay, now stay with me because I'm going to go back to the superior view of it. So I'm going to go back to this view of it, and I'll get rid of all the drawings here. Sorry about that. And you can see trapezius is still highlighted here. You can see trapezius right there as it comes down, and you can see it has a nice, move out of the way, has a nice attachment right here. It does have a little bit of a clavicular involvement down here, and then it comes across, and we're going to get that nice spine of we're going to get that nice acromion involvement right there, and a little spine of the scapula involvement also. Okay, so fairly similar to the deltoid. Now I'm going to flip them back, go back to posterior view. And you can also see it has that lower, the lower trapezius, the middle trapezius. And the upper trapezius, the fiber orientation actually is different. So this would be considered upper. This is considered middle. And this section down here is considered lower trapezius. It has a lot of actions, does a lot as it inserts, so keep that in mind. And obviously it has a very unique innervation, being innervated by cranial nerve 11. And if I say cranial nerves, you automatically should be doing mental gymnastics and going through all 12 of them in your head right now. I'm just saying. So besides trapezius, we got this monster of a muscle, Latissimus dorsi. This muscle, it's like a sail, is just, it's amazing, because not only is it so huge with this gigantic origin, but look what happens to it. We're going to rotate it. It's going to pass through the axilla and come all the way through, so we can see it's going to pass through our axilla, and it's going to insert into the intertubercle crest. Okay, so it's going to be in that intertubercle groove, that intertubercle crest. So that's the third muscle on those crests that I highlighted earlier in the video. So I'm going to see if I can isolate it. I'm going to roll back here. We're going to bring it back. I'm going to highlight it so you can really see. There it goes. It passes through, and boom, you can see where it is inserting onto that intertubercle crest. And if you can't picture it, I'm going to make this even, hold on, I'm going to make this even wider for us so we can really get a good illustration of it. There it is. So if you look at it, you have the long head of the biceps tendon, which we know is in that intertubercle groove. And look right here, Latissimus dorsi inserting into the crest or that intertubercle groove just below it. And obviously we have the other muscles. I'm not going to tell you what they are because I'm going to see if you can do your mental gymnastics and figure out the other two muscles that are inserting into the crest also. But Latissimus dorsi is going with teres major and subscapularis as the three muscles that are passing through that axilla and going basically underneath your armpit, okay? So let's see if we can get all our muscles back. There we are. We're going to go back, and the next one, we did teres major, we did supra, infra, teres minor, subscapularis, rhomboids. Here we go. In order to get to rhomboids, we need to do a little dissecting. So I'm going to take trapezius here. I'm going to remove trapezius. And there's rhomboid major, and just above it, rhomboid minor. Similar orientation to teres major, teres minor. Teres major underneath, teres minor on top, teres major big, teres minor small. Same idea here. Rhomboid major big, rhomboid minor small. And gee, I wonder where rhomboids get its name, because the rhomboid is kind of shaped like a rhombus. Well, there you go. So again, I think we want to thank the Greeks for that one. I'm not sure, but I definitely think that's a Greek thing. So thank you, Greeks. So there's our rhomboids on the posterior side. We've already done levator scapulae. Let's go to levator scapulae. You remember levator scapulae, I briefly highlighted it when I did the back muscles, right? So there's a nod to our splenius. Remember the splenius? Well, let's get rid of splenius. And if we come right here, there's sternocleidomastoid. So there it is. There's levator scapula. Levator scapula coming from that superior angle, right? So coming from that superior angle, medial border of the scapula, and is coming up to the cervical vertebrae. But it's a little muscle, pretty thin muscle, but it does obviously have an attachment point on the scapula, so that's why we're talking about it now. Now, let's get to one of my favorite muscles, and that is serratus anterior. Obviously, serratus gets its name from the Latin serratus, or serrated, saw-shaped. And we're going to appreciate why. Hello, posterior serratus posterior. Even this one, it has a serration. So you can even see here in serratus posterior, it has a serrated saw-like appearance. So we're going to get rid of serratus posterior because I am interested in serratus anterior. And there she is. Oh no, I lost all my muscles. I'll have to get all my muscles back. Not a problem. Here they come. Woo. There we are. And there is serratus anterior, really a unique muscle, and we're going to try to isolate it. So there we go. You can see definitely serrated as it attaches on the ribs. It's going to pass underneath our scapulae. So if you can sort of imagine the scapula, you can kind of see it highlighted here. I'm gonna sort of help you out here. So there's sort of scapula right there, okay? So serratus anterior is going underneath the scapula. I actually did a bad illustration because this is actually, this border right here is supposed to be the medial border of the scapula. So I'm going to actually redo it. So there she is. There's basically the scapula like that, because serratus anterior is going to attach to the anterior to medial border of the scapula. And that's going to hold that medial border to the thorax. That's why anyone who doesn't or has an issue with serratus anterior, you get that classic winged scapulae appearance, and we can do a whole bunch of different exercises to help mitigate that. So that's serratus posterior. Oh my gosh, serratus anterior, because it does start from the anterior side, those ribs, and actually rolls all the way around to the posterior side. So we got our muscles back. Let's go back to the anterior surface because we got the large muscle right here, pectoralis major. No such thing as pectoralis, please. And we're going to get rid of deltoid here. Hello, deltoid. You've been good to us, but we got to get rid of you. And you can see, I'm going to zoom this in. It's coming all the way across. So pectoralis major does not have an attachment point on the scapula. It doesn't. It's got sternum, it's got ribs, it's got clavicle, and then it comes straight across, clears your axilla, goes straight across your axilla, it inserts into the crest of the greater tubercle. So here we go. That's our our third crest. So there's the crest right there. There's greater tubercle right there. Ooh, bonus. 1, 2, 3. Can you name the 3 muscles of the greater tubercle? Mental gymnastics time. But you can see that pectoralis major comes straight across, inserts into that crest of the great. And actually, if you kind of reach into your armpit, and you're going to see a big piece of tissue that crosses your armpit. That's pectoralis major. Quite large, easy to palpate, easy to find. I'm going to scroll back a little bit so you can see its clavicular and external attachment points as we come back. I'm just going to highlight it for you so you can see where it's attaching and roll back. Excuse me. So that should be pectoralis major. I showed it to you previously in the video, but it was only a partial muscle. So we're going to actually eliminate pectoralis major, and we're going to find, there she is, pectoralis minor, that nice oblique direction. So it's weird that pectoralis major comes straight across, almost, horizontal, and pectoralis minor is on this unique sort of a diagonal. 1, 2, 3. Can you name the 3 muscles that attach to the coracoid process of the scapulae? But there's pectoralis minor. That's sort of that shoulder motion. It'll become very problematic. I get this a lot in our overhead athletes, especially our pitchers, volleyball players, etc. And obviously, because it has that anterior, I'm going to try to do a side view here so you can really appreciate the mechanics of it. Because it inserts into the coracoid process, it's going to pull the coracoid process in that direction, which in turn is going to kind of, I'm going to actually clear this so you get a better, I'm going to actually zoom out a little bit. There we go. So if you have a very tight pectoralis minor, it's going to be pulling in that direction. Agreed? It's going to be pulling the coracoid process. And what that's going to do is kind of give your scapula this position, and that really contributes to that hunched over, rolled shoulder appearance, which we all get. And so one thing that we really try to do with our athletes and our patients is we need to open up that upper thorax, and we do that by really trying to get them to stretch that pectoralis minor. It's sometimes a forgotten muscle, but it's extremely important with upper cross syndrome in our typically overly kyphotic athletes, etc. So don't forget about that guy. And that should take us through the shoulder muscle worksheet. That should be all of them. Again, I got the full cadaver up here for you. So if you want to pause the video and try to review some of these lower extremities while we're down here, feel free to. Obviously, the facial muscles, if you feel like you want to go through the facial muscles, they're all here. That's a gift for Sarah. I kept those in for you. Otherwise, if you don't have any questions or concerns, best of luck, and we'll be practicing this in class.